As our journey draws to a close, we reflect on the remarkable resilience, determination, and unity displayed by adolescent girls and young women, AGYW, across Botswana, Malawi, and the Democratic Republic of Congo. Their voices, though distinct in accent and language, echo a universal demand for transparency and accountability in healthcare funding.
We do a lot of advocacy work related to improving health outcomes for young people, particularly adolescent girls and young women. So Show Us the Money is literally exactly just that. We want to know where the funds that are invested for programming for young women are going, how they can be part of the process, and how they can also influence the decisions that are made affecting their health and their rights.
In Botswana, we witnessed the fervent call for transparency in healthcare budgeting, led by AGYW, who refused to accept the status quo. They are the architects of change, carving a path towards a future where healthcare is not just a privilege, but a fundamental right.
They should be, what should I call it, a bigger picture. There should be a bigger plan, because like we still have a lot of youth. Despite having all of those things, there's still a gap that's there which needs to be addressed. So I need to see that. I want to see that be like visibly, not just being said, because a lot of times we talk with no action. You know, with the budget we see, okay, it is included, but where are the implementations? They are not there. Where are the projects? They are not there. We still have a huge gap when it comes to the youth.
And I remember one time, most of our demand was around implants, and we had no implants, and that means we can't force young people to take a certain contraceptive that they would ideally were not there for, and that means they're going to return without the service that they needed, and that opens a lot of risks to a lot of things, your teenage pregnancies, contracting HIV and AIDS, because we have experienced stockouts of condoms as well. And during that period, we experienced a very, a slight increase on the number of new infections amongst adolescents and young women.
Yeah, you know, it goes without saying. It's all out there that the more people are involved in terms of things that affect them, say, for example, health issues. If you bring the people that are affected, if you bring the people that are more vulnerable than anybody else to come to the table, to be part of the decision making, it's a plus in that you don't have to do guesswork. You don't have to imagine what is it that this group wants. The group will be there at the table helping you make good decisions.
As I have done this in different countries, and also having to be part of such movements in Botswana, I've been able to build a bridge for young women to be able to engage with local leaders at community level, at religious level, and even at parliament level. I'm talking of young women being able to communicate how they would want services to be given to them.
Across the border in Malawi, AGYW are at the forefront of grassroots activism, rallying communities and policymakers alike to prioritize transparency in healthcare funding. Their unwavering dedication is a beacon of hope, illuminating a path towards a healthier and more equitable society.
Ndama kwacha ikungogwa pafupi nthawi ndi nthawi. Ndalama sikupezeka koma zinthu zikukwera. Komanso mzipatala mankhwala sakupezeka. Ukulembesa mankhwala akukuza kuti ena ukagule ndalama isakupezeka. Chimenecho kwa ine chingakhale chipinjo, komanso kwa anthu ena chingakhale chipinjo, chifukwa dziko lathuli ndilosauka kale koma zinthu zikukwera.
The model which we've been using so far, it's more of youth-friendly services in the static facilities. We've accredited about 60% of our health facilities as youth-friendly. And to maintain the youth-friendliness in the facilities has been a challenge. If we talk to the youth want to be serviced by the youths themselves. All right, so to get service providers who are youthful all the time, it means you need to constantly train new providers.
Upon the discussions that Arasa and for Equality hosted here today, I'm feeling extremely excited, and I'm also feeling very progressive and forward, because usually when it comes to issues of SRHR and HIV and AIDS programming, we usually look at numbers, collective narratives that are brought in by different organizations, including the government, but rarely do we get to interact with people who are living in those experiences.
Osatira chake kwambiri ndi choti achinyamata ambiri adziwano kuti ifeyo tili ndi udindo komanso ufulu oti tizisata nkhani ya za chuma kuti kodi zikuyenda bwanji pa nkhani ya umoyo wa achinyamata komanso pa nkhani ya HIV and AIDS.
They also expressed the need to have a coordinated effort towards this advocacy space. I think this was because most of them identified that it's the movement, the health budget movement, is dismantled and discoordinated, and it lacks the youth voice and the stories behind it, behind those people that are impacted the most, which is the youth.
Meanwhile, in the Democratic Republic of Congo, AGYW are amplifying their voices, demanding accountability and transparency from those in power. Their collective action is reshaping the healthcare landscape, paving the way for transformative change that benefits all.
Les na chuchu bajan, ce qu'on a besoin, il y a quelques radios et ce qu'on a petit information parce que tout qu'on a manqué en information. Ce qu'on a plutôt bien mingi bi comme à tout bio et jo akuna mwenye atatu informer. Ina tulomba sasa baba mama beba na tusaidia bene na tulogota pour que ba to informer na shi. Mengi kwa banesu kwa nele radio kwa banesu kwa nekala bana bisema na kila mtu anabikapta na bisikia, ça peut être mieux pour eux.
Il y a multiples stratégies, entre autres, il y a la plaidoirie, il y a des sensibilisations, il y a des formations, il y a des ateliers qu'on organise. On essaie de faire des plaidoyers au niveau de cadres de base, des leaders communautaires, mais aussi auprès des autorités pour avoir accessibilité dans la communauté, pour sensibiliser. Des ateliers qu'on organise pour renforcer les capacités des leaders religieux, des cadres de base, des autorités locaux, pour qu'ils aient la bonne information. Et sur base de ça, on peut descendre dans la communauté pour donner la vraie information, parce que tu ne peux pas arriver dans la communauté sans pour autant passer vers le cadre de base. Il y a des plaidoiries qu'on essaie d'organiser au niveau des autorités pour regarder si le jeune peut avoir les espaces dans lesquels ils peuvent se mettre et discuter de certains sujets qu'on traite dans la communauté étant des sujets tabous.
Par rapport au plaidoyer budgétaire de la santé, nous avons amorcé les premiers pas, qui étaient d'abord de conscientiser la communauté, les adolescents et jeunes, qui doivent comprendre qu'ils doivent aussi lutter et travailler ensemble avec les organisations, démontrer leurs besoins et avoir accès à ces soins et traitements. Les implémentations que nous sommes en train de faire avec la société civile, c'est une nouveauté. Ce sont des programmes que je dirais qui n'existaient pas.
D'abord, le premier défi, c'est le défi de la disponibilité des services de santé. Le deuxième défi, c'est l'accessibilité à ces services. Le troisième défi, c'est la qualité de ces services. Le quatrième défi, c'est l'ignorance. C'est évidemment le manque d'informations adéquates et appropriées par rapport à leur santé.
Let us heed their call. Let us join hands in solidarity and support their efforts to hold governments and institutions accountable. For in their courage and determination lies the promise of a brighter, healthier tomorrow for all. AGYW from Botswana, Malawi, and Democratic Republic of Congo stand together with the sun setting behind them, symbolizing hope for the future. Together, let us show them the money. And together, let us build a world where healthcare is not just a privilege, but a fundamental human right. Thank you for joining us in this journey through Botswana, Malawi, and Democratic Republic of Congo. May the voices of AGYW inspire us all to create a future where health equity knows no bounds.